Thank you, Vicky, for the lovely introduction. Good afternoon, and thank you for all of you to join us here today, and for BCNA giving me the opportunity to come up here and speak, which is a bonus for me because my sister lives in town, so I do come up here quite a lot. So I'm based in Perth, but Karratha is dear to my heart, and our dad used to work for Hammersley Iron back in the day, so we've had a strong connection to Karratha. I was first diagnosed with breast cancer in 2000 at the age of 35. I was super fit, I was an athlete, I lived a healthy lifestyle and we had no family history. I went through 2 operations, 6 months of chemo and 30 radiation sessions, and 5 years of hormone suppressant tablets. Things went back to normal after this, and only with annual tests and a few scares along the way, my life went on. In April 2020, 12 years after my early breast cancer diagnosis, I was diagnosed with metastatic breast cancer after I had bouts of pain in my sternum. After a battery of tests, I was treated with another round of radiation and put back on hormone suppressants. I also then started having 2 monthly injections, one to stop my ovaries and another one to try and keep my bones from breaking down. In November, I found another 2 spots, and then I had to up my hormone tablets, which put me straight into chemically induced menopause, which is so much worse than normal menopause, and then testing became 3 monthly. With my metastatic breast cancer diagnosis, I was so thankful for the information that I could access from BCNA. My journey kit, or I think it was Hope and Hurdles back in those days, was amazing, because if you go Dr. Google route, there is so much out there, whereas it's all evidence-based and it was accurate. It was a one-stop shop. My first line of treatment lasted 8 years. And in 2020, a lump developed on my collarbone, and sure enough, it had returned. And there was another tumour in my sternum. So I had another 3 months of chemo and started Herceptin. If BCNA had not lobbied to get it on PBS, I don't think I'd be here today, as there was no way I could afford it. Also in that year, my mum was diagnosed with breast cancer through breast screen. Going through the whole ordeal with mum gave me a fresh look at the process and the advancements that had been made since my initial diagnosis. Over the years, I've attended BCNA information forums and utilised many of their resources during the horrible year of 2020. I applied to be a consumer rep and graduated, as Vicky said, in December 2020. I wanted to give back and make a difference in the lives of those affected by breast cancer. And being a consumer rep with BCNA was the perfect platform. Since 2001, BCNA have run an internationally recognised consumer rep program, Seat at the Table. A BCNA representative is someone diagnosed with breast cancer that is trained to represent the broad views, as Vicky said, and the experiences of people affected by breast cancer and can speak on their behalf. As a BCNA consumer rep, we do not simply express our personal opinions, instead we speak for a defined, wider group of consumers. The role is voluntary, and people diagnosed with breast cancer in all states and territories are welcome to apply. We help to ensure that the diverse voice of those affected by breast cancer is represented in BCNA's work, in not only policy and advocacy, but all aspects of the breast cancer journey. So some of the activities I'm involved in is the Metastatic Lived Experience Group. This group exists to improve outcomes for people living with metastatic breast cancer by using the group's lived experience. We do this by providing insight into topics and emerging issues affecting Australians with metastatic breast cancer. We consult on BCNA's policy and advocacy policies and messaging in the delivery of breast cancer care in Australia. We help drive and inform improvements and provide insights to BCNA's content development, including evaluating and designing feedback on delivery of forums and events to ensure that they meet all of the people's needs affected by metastatic breast cancer. We also work with BCNA to help in the planning and activities to raise community awareness of metastatic breast cancer during the Breast Cancer Awareness Month in October. A major project, as Vicky touched on, is Making Metastatic Breast Cancer Count. It was launched last year. This issue's paper is to seek to highlight the gaps in our current cancer data. This is due to the fact that we do not know how many people are living with metastatic cancer in Australia, because they only register the incident and the mortality. There is no data collected on reoccurrence or staging. This makes it virtually impossible to adequately plan and deliver medical and supportive services to this group. Modelling suggests there's over 10,000 Australians living with metastatic. Oh, that's me doing my Easter bunny having chemo. I try to make it fun at chemo. The another group I'm in is Field of Women Working Group. This is a signature event which aims to bring the statistics of life of breast cancer in a meaningful and visual, powerful way that highlights the personal impact of breast cancer on our community. The Field of Women Live means that people join together to form the BCNA's Pink Lady, but you can also buy a virtual ticket to participate if you can't get there. It'll be the feature event acknowledging BCNA's 25th anniversary and achievements and advances that have been made supporting Australians with breast cancer over this time. The committee that I'm on was formed to ensure that all people are represented, and this is an amazing event in its 6th year. I was lucky enough to attend in 2018, and I look forward to joining them again on August the 20th at the MCG. I feel that this is one of the most inclusive groups I've worked with. We have representatives with breast cancer from regional and rural, First Nation, men, women and men with metastatic and LGBTIQA+. I feel that all the diversity within breast cancer will be truly acknowledged at this event. The Beacon, which is their signature newsletter that comes out, I don't know where that is. Anyway, so the Beacon, I am involved in the editorial team, and this is to ensure that we have meaningful consumer input. We will work with the team in the development of ideas and topics to ensure that it is a truly customer-driven publication. Now, outside of BCNA, I'm also involved with Breast Surgeons ANZ, which is the Breast Quality Audit Committee. I'm a consumer rep for this committee, which is made up of breast surgeons from around Australia and New Zealand. And I tell you, it's like herding cats to get them to come to a meeting. The committee was set up to create a standardised and centralised breast cancer database of surgical activity in Australia and New Zealand. It collates data for research and statistical purposes and allows surgeons to compare their own surgical practices with those of their peers. Other benefits of the BQA are assessment of management trends and also promotion of the uptake of evidence-based evidence-based research and ensuring that there is surgical practice benchmarking. Over the years, I also review research submissions and lots of brochures for hospitals, and somehow I ended up doing all of Westmead Sydney's. But I was pleased that when Mum was getting her treatment, they handed her one of the brochures that I'd reviewed. So now I know that they're actually all over Australia. I try to ensure that the consumer brochures are easily understood by the general public. And with the research submissions, there is a technical one and then there's a general one. And the general one is the ones they put out to try and get the actual dollars. So it needs to be of an equal and readable publication. On a local level, I'm a consumer consultant for the Mount Hospital and also involved with Healthscope, who are the owners of the Mount, in their national consumer and oncology committees. I've been having treatment for 11 years at the hospital, monthly, and now I'm 3 weekly, and I wanted to advocate for fellow patients, especially in oncology, to try and help and ensure that we get the best possible care. I'm also a volunteer and an ambassador for Breast Cancer Care WA. And there's some brochures on your seats there. It is a unique charity which is only based in WA, and they run 16 support groups, and some of them are on Zoom, so they're available to a lot of people all over the state. They have staff that are especially breast cancer nurses and counsellors who are available free to charge to anyone, including your family if they're having a hard time, and they're only a phone call away. And I must say, since COVID, they've become very proficient in Zoom and online activities. BCNA also host a mountain of resources, which Vicky has touched on, so I won't go on those again, but they are amazing resources. I'm passionate about make sure that people have support that they need right from the start. I've been in the waiting rooms for 23 years and seeing people come out so upset and lost and not knowing what to do is distressing. My relationship with BCNA is a two-way street. We're here for each other and I love the opportunities that they've given me. The friendships that I've made, not only with staff but with fellow consumer reps, will be lifelong. Being involved with BCNA has given me a sense of purpose and a sense of community and has opened up many new experiences. When I had to retire from my job as an operations manager for 3 states, I was lost. I knew I couldn't do the 10-hour stress-filled days anymore and I needed to find something that I was passionate about. The benefit of this kind of work is that I can pick the projects that interest me and the meetings are not that frequent and I can do them in between my treatments and endless testing. Zoom has made such a huge difference with most of the work being done from home. When I was diagnosed with metastatic breast cancer, I was told the average survival rate was 2 to 3 years. I've now made it to 11 and I'm so thankful to still be here. I've not only found my mission in life, but I've also found a way to make a difference. Also made a difference and hopefully help drive the delivery of optimal care and better outcomes for those affected by breast cancer. I've been living with cancer for 23 years and I want this to be my legacy. Thank you.